20-minute SBT. Real common COPD. So we can get them on a short-term SBT, but we can't get them all the 30 minutes, which is the requirement. But they could do it for a little bit. So what could we do? Yep, extubate to BiPAP. Or with BiPAP on standby. The doctor will say, go ahead and extubate the patient, have BiPAP on standby ready to go, which means have it set up with a circuit, with a mask, with settings kind of already planned. So we'll go ahead and extubate. So you can either extubate to BiPAP, like they'll just say put them on BiPAP, or extubate with BiPAP on standby. Because it would be better that they end up on BiPAP for a couple days so they really gain their strength back, as opposed to staying on the vent for a couple more days. So this might be a patient who needs BiPAP for 2 or 3 days. That's okay. They can use it around the clock in the ICU. Let them get their strength built back up. If you need to, you can then go down to a high-flow nasal cannula. This is exactly what we talked about yesterday. So they go to BiPAP, then they go to high flow, then they go to a nasal cannula and hopefully home. You also could, if your patient doesn't tolerate BiPAP, you can go right to high flow. So we can put a note, let's say BiPAP not tolerated. Although most of these patients tolerate it well. You extubate, BiPAP not tolerated, then you could go right to high flow nasal cannula as something. Come on. We're just finishing up, Bobby. Come on. Take a shot.